Good afternoon. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 511 new cases of COVID-19. This brings our statewide total to 73,405 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Tragically, 5,742 deaths are now attributed to COVID-19. Statewide, we are now estimating that 68% of people with COVID-19 have recovered. Today, I am pleased to announce a partnership with the Jewish Healthcare Foundation to establish the Southwest Contact Tracing Consortium. This consortium brings together community business organizations and employers, federally qualified health centers, and county human service organizations, foundations and health systems, and colleges and universities with public health officials to work to increase contact tracing in Southwest Pennsylvania. This consortium is the first of many regional groups across the state that will help assess the number of contact tracers needed in each area, help recruit and train them, and coordinate information and data to ensure consistency. To increase our contact tracing, we have also been working with Temple University School of Public Health. During the month of June, we will be training 200 students from Temple to help with contact tracing. We have also been working with the Penn State College of Medicine to recruit medical students to do contact tracing, and so far there are 46 medical students helping with this effort. Now, in addition to contact tracing, our teams are working on increasing testing capacity throughout the state. We are very excited today to announce a new partnership with Walmart and Quest Diagnostics to increase testing for residents living in areas where there are fewer testing sites. Over the next few weeks, 19 free testing sites will open at Walmart locations across North Central and Northwest Pennsylvania, and will be testing residents on Monday, Wednesday, and Friday mornings from 7 a.m. to 9 a.m. Anyone who needs a test can get a test. Anyone. The Department of Health and the Wolf Administration are dedicated to health equity and non-discrimination. We are removing barriers to testing, including cost, to ensure the accessibility and availability of testing for all Pennsylvanians. Residents must register one day in advance through Quest. Up to 50 patients can be tested per day. The first 5 drive-through testing sites will begin actually Friday on June 5th. These site locations will occur in Clarion County, Erie County, Montoursville, Clearfield, and Hermitage. Additional sites will be announced prior to their opening in the next few weeks. Residents can find a map of these locations and their addresses, as well as the link to Quest's portal to register on our website, health.pa.gov. Again, residents must register through Quest Diagnostics to confirm their appointment. We are taking every precaution to make sure that residents who are being tested don't expose healthcare workers or the community to COVID-19, so people are required to stay in their cars to get tested and then drive directly home to self-isolate if they're having symptoms of COVID-19. Certainly, if symptoms worsen while they're waiting for test results, they should speak with their healthcare provider. Of course, always, if there's a medical emergency, please seek immediate care. Patients will receive an email with their test results from Quest within 24 to 48 hours, and actually physicians will call any patient who has a positive test result. Residents will be able to also view their test results on Quest's patient portal. For information and additional questions about the testing process, we have more information on our COVID-19 page on our website at health.pa.gov. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. Please use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And please don't touch your face, especially after touching surfaces. Clean surfaces frequently. And when you have to go out, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your health care provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. If you or someone you care about needs help with a substance use disorder, please call the Department and Drug and Alcohol Program's Get Help Now hotline at 1-800-662-HELP. Again, 1-800-662-HELP. For the most reliable information about Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay alert, and stay safe. And now I'm pleased to answer questions.
Jackson?
The Department of Education provided more detail about schools reopening in the fall today. With students potentially congregating more, do you have any concerns about a potential spike in MIS-C cases?
Well, so, we're still learning about that MIS-C, or multisystem inflammatory syndrome in children. This does not seem to be an active infection with COVID-19. It seems to be a post-infectious process several weeks after an infection, and it's a inflammatory reaction throughout the body. We're still learning about what causes that and learning much more about it. I think that we will be monitoring for that, but since we don't actually know what seems to trigger it, then that's hard to say.
Do you have an idea of how many cases there have been in total in Pennsylvania so far?
Yes, I think that's available on our website. I'm not remembering the numbers exactly in our head, but it's either on our website or we'll get that to you. We are seeing that syndrome in Pennsylvania taken care of by our excellent children's hospitals and other hospitals, and they are ill children and receiving often intensive care.
Rachel and Alex.
How much PPE does the state have in reserves in preparation of a second wave?
Well, we do have PPE in reserve, but we're getting it in every day. N95 masks, gloves, surgical masks, hospital gowns, etc. And to be honest with you, we're pushing that out. And we're pushing it out primarily to long-term care centers, such as nursing homes and personal care homes. So we're really not keeping it at this time. I know the federal government is starting to stockpile, and we'll discuss when we get to the point where we'll actually stockpile some, but right now we're receiving it in, processing it, putting it out to those facilities.
Alex and Todd.
Yeah, Secretary, if you could just talk about your department's involvement with the Department of Education and kind of reopening schools in the fall. Secretary Rivera said today they worked with you to kind of put out preliminary guidance. What you want to see schools and school districts prove to make sure they're safe in the fall.
So, everything we're doing is a collaboration with the departments, and certainly in the times of a global pandemic, the Department of Health is collaborating with many departments, including Secretary Rivera and the Department of Education. I don't know if schools have to prove anything, but we're going to need to monitor the situations really carefully among children and then in our communities in general for any spikes in the fall of COVID-19.
Will masks be required or suggested for students? So
masks will be suggested for students. There are some medical conditions where people can't wear masks, but yes, masks will be part of the process.
Todd and Greg.
Secretary, Dauphin County just moved to yellow on May 29th, which means no large gatherings. And apparently there's a march going on that has more than 200 people in it today in Dauphin County. Can you clarify the administration's position on May 11th? Business owners were called cowards for wanting to reopen their businesses, and today the governor is actually marching in that. Is that not in violation of your order and his order for large gatherings?
Well, so we have, then the governor has always said that people have the right to protest and to demonstrate and the right of free speech. And so overall, we want large gatherings such as maybe a party or some type of concert or something to be under 250 people. But we are not restricting people's right to protest. There are also obviously significant social issues, that are present, that people feel that they need to have a voice. And so the governor is always supportive of that and is participating in that. April, there is a question back there I just want to point out to you.
Okay, thanks. Cody, then Ford.
Secretary, Erie County after Friday will be one of 2 counties still in the yellow. There's now bipartisan calls calling for the county to move to green as soon as possible. I know you don't like to give kind of information prior to that day of when you're going to move a county or make a choice, but can you give us any kind of inclination about when Erie County may move to green? So
I can't tell you when Erie County will move to green. We're going to be looking at all of our numbers and modeling tomorrow. We always do that on Thursday. The Carnegie Mellon University modeling will come out tomorrow. We'll be looking at the numbers of new cases, the incidence rate or the number of cases per capita. We'll be looking at those trends. We'll be looking at the percent positivity of their testing and all of it over the last 2 weeks. And then we will discuss that with us, and we'll discuss it with the governor, who makes the final decisions of counties that go from yellow to green.
Okay, Ford, and then Jim.
Thank you, Dr. Levine. I think I'm being screened here a little bit.
That's why I pointed you out.
Appreciate that. So I actually want to follow up on
Sure.
that. My question was going to be about the governor's statement, I think it was 6 days ago, when he talked about these 3 criteria for advancing to a new color phase now. And I think you just touched on, I think, 2 of them, but isn't there a third about recent virus outbreaks?
Sure. We want to see if there's any significant outbreaks that might impact that as well as all the different numbers and modeling that we have. And the key is what the trend has been over the last 2 weeks that will determine our decision whether any county goes from yellow to green. We want to see those trends going down as opposed to going up. If any county has significant trends upward, that would make it really challenging. If we're seeing the trends go downward over 2 weeks, then that's a very positive finding.
Just to follow up, those 3 measuring sticks, are they the main, the governor mentioned those, not like you said, there are others, including the modeling. Are those the 3 main measuring sticks for county?
So we're going to be putting out kind of a scorecard on Friday so that people can see exactly what we're looking at. So we also take in consideration the testing availability in counties. Now, of course, in Erie and some other north central and northwest counties, we're going to be increasing that testing availability. We're going to be looking at the contact tracing ability in those counties to make sure that we can identify any type of cluster and prevent large outbreaks. So we also look at the hospital capacity and the ICU capacity in areas. So all of those issues, which are actually many are identified in the CMU model, but all of those issues go into our decision, and we will be putting out kind of a scorecard so that people can see exactly what we're thinking of. So we've been talking about it a lot, but we want to make it visual.
Jen, then Sarah Goulet back for some questions.
Hi, thank you.
Hi.
I just had a question going back to the more testing and available testing that's going to be in the western part of the state and coming across as we go on. Are you encouraging asymptomatic individuals to go in to get tested as well, or are you trying to keep it reserved for individuals who are showing symptoms?
So we are prioritizing testing among symptomatic individuals, but that can be any symptom. I mean, so there are not many different symptoms associated with COVID-19. So classically, it's going to be fever, cough, and shortness of breath. But we know now there's lots of different symptoms that people have. It could be abdominal pain and diarrhea. It could be a mild cough, could be a serious cough. And we know that some people are very mildly symptomatic or even asymptomatic. So anybody can get a test, but we are prioritizing symptomatic individuals. What we're not yet doing, but we would like to when we have a very accurate, rapid point-of-care test, is to do more population-based surveillance testing. That we're not doing. But if people feel that maybe they've been exposed or they want to test, they can go get a test.
follow-up, any idea when those tests could be coming, that kind of test?
So we're working with companies. There are companies in Pennsylvania and outside of Pennsylvania. I can't tell you exactly what date those will be coming, but we're hopeful that, as we prepare for the fall, that those tests will be available.
Sarah Gillian, let's take you for 2 questions, please.
Okay. Secretary, this is from CBS 3. Is southeastern Pennsylvania still on track to move to the yellow phase of reopening, and what are the main parameters guiding that?
Yes, southeastern Pennsylvania, including Philadelphia, are still on track to go to yellow on Friday, and the parameters are everything we just talked about. So they include the number of cases over the last 2 weeks, the number of cases per capita, which is called the incidence rate. We're looking at those trends. We're looking at the percent positivity of the tests that are done, and that has been going consistently down throughout the state, approaching 5 actually, which is 5%, which is much lower than it had been before. We are looking at, of course, the availability of hospitals and ICU beds, as well as the ability of contact tracing and testing. So all of that goes into our decisions, but we're very comfortable with Southeast Pennsylvania.
This question is from Public Source. Given that the Pennsylvania Department of Health last week held its first consortium in the Southwest region to discuss contact tracing needs, how many contact tracers are anticipated to be needed, and how many does the region currently have?
So I can't tell you exactly how many the region has. I know the Department of Health has over 380 contact tracers, and that does not include the county and municipal health centers. So that doesn't include Allegheny County, which has its own health department and its own contact tracers. Doesn't include Erie, doesn't include Philadelphia, et cetera. So 380 that we're working on, and we're working to expand that. I mean, really, we would like thousands of contact tracers in all of those areas by the time of late summer or early fall.
For children, Todd.
Why aren't nursing home residents who tested positive for COVID-19 recovering in the hospital until they test negative versus recovering in a nursing home?
So it can take weeks for someone to test negative for COVID-19. So that is actually not a criteria for someone to be well or to, if you have a COVID-19 and you go back to work, we are not requiring tests to prove that you're negative. It can be weeks and weeks and weeks before people test negative. We don't think that they're very contagious or contagious during that time. And the test, of course, is testing for the DNA. So you could be shedding the DNA even though you don't have live virus. So it is not practical to have people stay in the hospital even though they don't need hospital care for weeks and weeks waiting for a negative test. No one is requiring that. That was one of the earliest criteria in Wuhan, China, and it was rapidly found out that you can't do that. So there's specific criteria for the CDC of when you're no longer contagious.
Todd, then Cody.
Secretary, on the school reopening guidance released earlier today, we're already hearing some pushback and some concerns. What kind of discretion do school districts have in following that guidance? And you've already touched on masks a little bit, but how much leeway do the districts have individually?
Well, I'm going to leave that actually to questions for the Pennsylvania Department of Education. So I know that there is local control, right? So school districts, but in terms of that relationship, I'm going to really defer to them for that answer.
Cody and Justin.
Secretary, there's been a lot of talk about the second wave happening sometime in the fall. Do you have any idea of when exactly that second wave might happen, what it might look like, and how, if any, or what preparations, if any, Pennsylvania is making for the second?
So for the first number of questions, actually, no. We don't know what that's going to look like. We don't know when that will occur. We certainly know the normal course of influenza in terms of starting in October and then increasing through November, December, peaking January, February. But coronavirus is not influenza. So we are anticipating a potential increase in the fall. The Dr. Fauci, Dr. Birx have discussed that potential. We don't know exactly when and how that will occur, but we need to be ready. And so to be ready, we want to have robust testing. We're hoping for the type of testing that I discussed before, a very rapid, accurate, point-of-care tests that could be done very easily by any healthcare personnel or even by a layperson to be able to tell, within 15 to 20 minutes that someone is positive or negative with really, really good specific sensitivity. In addition, it's possible that antibody testing could be very, very helpful. So we don't know a lot about the meaning of those antibodies. We're hopeful that they're meaningful, that people have at least partial protection. We would need a very accurate test, and there's some questions about the accuracy, but also perhaps a point-of-care test that a doctor could do with maybe even a finger prick of blood for antibodies. That would be really helpful to know that people are at least partially immune. And then we're going to want extensive testing and extensive contact tracing throughout the state, and that will put us in the best position to prevent a substantial increase in cases in the fall.
And you say that Pennsylvania needs to be prepared for all this, but can you predict that they will be prepared?
Oh yes, we will be prepared. What I can't promise you is that those tests, which are still in development, will be there. So we will adapt to whatever testing is available. But I am hopeful that those type of rapid, accurate tests will be available. That would make things much easier.
Justin and Jen?
Leading up to yesterday's election, the state enacted some reforms that allowed counties to consolidate polling places. And from a public health perspective, do you have concerns about potentially funneling, more voters into fewer spaces? And if, something like that is allowed for the fall, would you recommend against that?
Well, we want to make sure that people who are exercising their constitutional right to vote are also safe. And so we want to make sure that they're wearing masks, that they're practicing social distancing in terms of how far apart they are, that we're using hand sanitizer, that we're keeping the polling places, very, very clean, etc. And I think that that will be really important as we head into the fall. In addition, one of the most important things is voting from home. And so I think that offers the safest way for people to vote. And I know the governor has been strongly supportive in this election for people voting from home by mail. And I know that we'll be very, very supportive of people voting by mail, which is the safest way to vote, given that we're in the middle of a global pandemic.
Just a quick follow-up on that. I know Allegheny County consolidated hundreds of polling places. Does that raise any red flags to you with, there were a lot of people voting in person yesterday. Does that worry you at all?
Well, I know there were specific reasons for that. I'm not plugged into the exact issues in terms of the Department of State and the elections, but I know that there are, for instance, many facilities often voting in nursing homes and long-term care facilities, et cetera, where you couldn't do that. And so there are a lot of good reasons why they did that. I think as long as people are able to practice all the measures that I talk about every day, that would offer the safest way to vote in person. But by far the safest way is to vote by mail.
Jen? And Michael, do you have anything? Okay.
Going back to talking about the fall, when it comes to this green phase, has there been any specific discussion as to eliminating phases in the fall? Is it going to continue? If a second round is considered possible, has there been any indication that, or specific discussion that we would come out of this having any kind of label at all?
So we have had some preliminary discussions, but again, concentrating on counties that are still right now actually in red, that'll go to yellow on Friday, and then many counties that still will need to go to green. That's where our attention mostly has been in terms of that. And the governor has emphasized that the points that I mentioned before in terms of being prepared for the fall are critically important because no one wants to issue stay-at-home orders anymore.
At this point, as a follow-up,
Sure.
as people's attention turn to other things going on in the world civilly, et cetera, is there anything you want to specifically stress to the public? Because there's a good portion of people who are saying this is behind us and they're moving on.
Well, the governor has said over and over again that we're in a new normal. So COVID-19 is not behind us. We still have COVID-19 in Pennsylvania. There's COVID-19 throughout the country and throughout the world. There are significant outbreaks happening right now in South and Central America. So the world and the United States is not beyond COVID-19. And I think that's why I say stay alert now every day, is that I think that people need to stay alert. People need to stay vigilant that COVID-19 is still here. We need to wear masks. We need to practice social distancing. We need to wash our hands. We need to use hand sanitizer, and we all need to stay alert.
Michael?
Yes, with schools now being allowed to open in the fall, what are the guidelines that are going to be put in place to keep these students safe?
So those guidelines were all outlined in the report that the Pennsylvania Department of Education just released today. But we're going to want to practice many of the different things I just talked about. I don't, in front of me, have granular detail in terms of their guidelines, but they just issued their report and it's available on the PDE's website. Thank you.
Rachel?
Back in March, the FDA had approved rapid tests for healthcare workers. Are any Pennsylvania hospitals using these rapid tests?
So there are some hospitals that are using the rapid test. The current rapid test is the Abbott test. There had been significant issues getting enough testing kits. I know that that's better now. It's one kit per test, and so you have to have a lot of kits to be able to do a lot of that testing. But the FDA has also put out an advisory that there are concerns about its sensitivity. Sensitivity means its false negative rate. That's really concerning if you have a screening test. If you're having a screening test and you're testing lots of people, you want to be sure that it's accurate, that you're not missing people. And so I think it's a valuable test. It's the only real point of care test where you can get a result within 15 or 20 minutes. But with concerns about its sensitivity, I think we will eventually need more sensitive, more accurate rapid tests in the future.
Todd, and then back to Sarah Goulet.
Secretary, you mentioned the new normal after the green phase. What does that look like? What metrics or thresholds will need to be achieved? And will the scorecard coming out on Friday reflect that?
Well, the scorecard will be coming out what counties need to do from yellow to green. The new normal is going to continue, and that means wearing masks. We're going to want people to wear masks for the foreseeable future when they go outside and going to encounter people. We want people to wash their hands, really well, and pay attention to that for the foreseeable future. We want people to use hand sanitizer liberally for the foreseeable future. We want people as much as possible to continue to practice social distancing for the foreseeable future. So that's what the governor means by the new normal. As we were saying before, COVID-19 is not gone. And we do not have anywhere near herd immunity, really anywhere in the world. There have been some surveillance testing using antibodies. There's some questions about the antibody tests, but looking at antibody levels, and there's no place in the world that has herd immunity. We're going to need to continue to be vigilant about the risk of COVID-19 for the foreseeable future, really until there is a safe and effective vaccine that can be distributed.
That's a follow-up. Is the vaccine kind of the cornerstone of what you're looking for as a threshold?
Yes. So the way to get through this without enormous number of cases and loss of life is going to be through a safe and an effective vaccine. And I know obviously the federal government is working really hard on promoting that.
Sarah Goulet, back to you for two.
This is from,
Ford.
oh, go to Ford. Okay, sorry.
Dr. Levine, I just wanted to ask about the herd immunity. There have been, when you read the international press, there is either in Sweden or Switzerland, there's a lot of talk about developing it there. Are you discounting that as there hasn't been progress towards that?
So the evidence from Sweden is that they have not developed herd immunity. So that was one of their goals. But the antibody levels are not anywhere near herd immunity in Sweden. And they also had, as every other country did and every other state, significant issues in terms of seniors, particularly those in congregate settings. So, I think that the example of Sweden is not an example for the world. They had more cases, more deaths than any other country in the Nordic region.
Sarah Goulet.
From the public source, could you provide an update on MISC cases in Pennsylvania?
So I don't have the specific numbers on MISC, but April does, and it's available on our website. I just don't have them in my head, but we are seeing cases of MISC in Pennsylvania. They're being cared for in our excellent hospitals, and we can, April can give them the specific data right after the press conference.
And then one more, Sarah.
From ABC 27, the PIAA has asked for additional guidance for high school sports resuming activities in a safe manner. The governor's plan states that youth and school sports are allowed in the green phase, but the PIAA says it doesn't have enough information to allow its schools to begin practices or games. What guidance are you giving the PIAA, and what considerations should youth programs have when it comes to safely participating in athletics?
So I know the Governor's Policy Office is coming out with more information about sports in general and with youth sports. I would anticipate that this week, although sometimes things get delayed as they go through the review process, but I think there'll be more detail about that. All that I would emphasize is everything I've talked about before, is that we have to realize that COVID-19 is still here in Pennsylvania and in the United States, and we have to take proper precautions.
All right, thank you, everyone. Thank you, Secretary.
Thank you very much.